Where are the ventilators? Where are the gowns? Where's the PPEs? Where are the masks? Where are they?
Hospitals getting supplies from the government's strategic national stockpile say some of the products are too old and have expired.
We've been warned over the years that, there's going to be a respiratory virus that's going to spread around the world, create a pandemic that is going to require significant increase in our PPE. But I think, many of us haven't listened to that. So how did we get here? The supply chain is key, and that is where a lot of the problems arise. We are making less domestically, and we are relying on exporters more and more for this important materials that we need sort of every day. In general, that's fine. The issue is places like China are responsible for manufacturing roughly 50% of the masks and respirators around the world. This COVID-19 epidemic started in Wuhan, China. A lot of the masks and respirators that they were exporting to other countries around the world, they needed it for themselves. The other issue with the supply chain is that, as you can imagine, there were many, many Chinese that were quarantined. And so they couldn't necessarily be working in the plant that manufactured this. So the demand became great, exporting was decreased, and they were making less. So it's like a perfect storm for creating a problem around the world and also in the United States. It was estimated that the Strategic National Stockpile had about 12 million N95 respirators and about 30 million masks. Some experts have estimated that's only about 1% of what the country needs to meet this massive epidemic that we're seeing with COVID-19.
We are demanding that we get all the hoarded supplies that exist of PPE so that we can protect ourselves, our families, and our beloved patients and communities. We can't do it if we're dead.
One of the reasons that we have less supply in the United States is because SARS back in 2002, 2003, remember that was the first novel coronavirus that we faced, didn't really hit the United States. With pandemic H1N1 back in 2009, 2010, in the end, the retrospective was that was much milder in the United States. Ebola, there was a lot of scare, but in the end, Ebola doesn't transmit easily from person to person. So I think we didn't learn some of the lessons that some of the Asian countries like China, like Singapore, like South Korea did that really allowed them to be better prepared for COVID-19 than we had been. Given that, and given where our strategic national stockpile is and how many health systems are in such short supply, I think the best we can hope for is to try to catch up.
Today I stand with the nurses to call upon Donald Trump, upon our local and our hospital leadership to stop looking for PPE that doesn't exist and start producing it. We are past the point of last resort.
And speaking of the Department of Defense, they're going to be sending us 10 million N95 masks that they had. And we're in great shape in every way. We're in great shape with ventilators. We're in great shape with protective clothing. We have additional plane loads coming in, but we're not getting any calls from governors at this moment.
If there's one lesson that we really have to learn from this pandemic, it's that the importance of domestic readiness to be able to manufacture our PPE. We cannot rely on other countries for the majority of our supply. And if we do rely on them, then we have to make sure that we have backup, that at a moment's notice, we are ready to unleash this PPE that's already been made, so we don't have to wait weeks or months for our own manufacturing to try to save the day.